Hello everyone, my name is Bashir Lawal. I'm from Graduate Institute for Cancer Molecular Biology and Drug Discovery, College of Medical Science and Technology, Taipei Medical University, Taiwan. I'm here to discuss the topic Multi-Omics Analysis and Potential Therapeutic Efficacy of NLOC15A, a novel multi-target small molecule for treatment of non-small cell lung cancer. Cancer is one of the most devastating hard-to-treat disease, and the global cancer as of currently, there are about 19.3 million new cases, and about 28.4 million new cases have been estimated to occur by the year 2040. Lung cancer is the second most commonly diagnosed cancer, with about 2.2 million new cases in 2020 and about 1.8 million deaths. There are several risk factors that have been attributed to lung cancer incidents, which are cigarette smoking, environmental pollutants, alcohol consumption, sedentary lifestyle, advised dietary intake, and hereditary predisposing factors. Tumor microenvironments contain several factors and several components, including extracellular components, several immune cell types, stromal cell type. And the complex interaction between these components of the tumor microenvironment promotes immune escape, allowing for tumor progression and metastasis and worse outcome of the cancer course. Therefore, identifying a novel prognostic biomarker that can inform of the immunogenic status of the patient and also improve our understanding of the mechanism of pathogenesis, diagnosis, and designing therapeutic strategies for the lung cancer is crucial. This study has two objectives. The first objective is to evaluate the clinical relevance of EPO, EGFR, MEK, and PI3K/mTOR signaling network in non-small cell lung cancer. And secondly is to analyze the therapeutic efficacy of a multi-target small molecule NLOC15A for the treatment of non-small cell lung cancer via targeting the YAP, mTOR, EGFR, and MEK1 signaling network. So this is the study design. First of all, we evaluate the clinical relevance of the gene signature by evaluating the expression level, the correlation between the expression level of this gene signature and the tumor microenvironment and component of tumor microenvironment. First, we evaluate the correlation between messenger RNA expression level of the mTOR, EGFR, MEK1, and YAP1, and tumor infiltration of immune cells, including the cytotoxic lymphocytes, T helper cells, and myeloid cells, while immunosuppressive cells considered include cancer-associated fibroblasts, myeloid-derived suppressor cells, regulatory T cells, and tumor-associated macrophages. These are immunosuppressive cell types that are known to promote T cell exclusion mechanism. In addition to the immune infiltration, we also evaluate the differential expression level of this gene signature between the normal tumor samples and then the normal tumor patient and the adjacent non-tumor samples. In addition, we evaluate the expression level of this gene signature between tumor stages. We also evaluate the genetic alteration, the gene alteration of this signature, including the genetic alteration and epigenetic alteration. In addition, we conducted an in vitro study to evaluate the efficacy of this small molecule on the proliferation of two non-small cell lung cancer cells, including H129 and H1975. Furthermore, we conducted a molecular docking analysis to evaluate the binding efficacy between this small molecule and mTOR, EGFR, MEK1, YAP1 signature. Okay, this is the first result here. We have it that the regulatory expression of the EGFR, MEK1, mTOR, TAD1 signature is associated with the progression and worse prognosis of non-small cell lung cancer. We found that the expression level of this gene signature are highly overexpressed in the tumor sample when compared to the adjacent normal sample. In addition, this high expression level mediated worse survival outcome as cohorts with higher expression level of the gene signature exhibited lower survival duration when compared with the cohort with lower expression level. In addition, this cohort exhibited high hazard ratio when compared to the cohort with low expression level. We also divided the expression level of this gene signature by risk factors, and we found that the cohort with high risk factors exhibited high expression level of this gene signature. In addition, compared to the normal cells, we found that the expression level of this gene signature correlated with each other in the non-small cell lung cancer cell. Now, we evaluated the expression level of this gene signature between primary tumor and metastatic tumor. And we found out that the higher expression level of this gene signature exists in metastatic tumor, which indicated that this gene signature could be used for diagnosis of tumor metastasis in non-small cell lung cancer. In addition, the phosphorylation level of this gene signature were evaluated at different tumor stages, and we found that the gene signature, the phosphorylation of this gene signature are dependent on the tumor stages, suggesting that this gene signature could be used as a diagnostic marker for tumor stage for non-small cell lung cancer tumor stages and metastasis. Now, here is the genetic expression level of the gene signature. And we found out that this signature exhibited high genetic alterations in non-small cell lung cancer, where the B panels display the different type of the percentage genetic alteration of the mutation of each of these signature in non-small cell lung cancer, while specific mutation landscape of each of these genes were displayed here. In addition, we found out that the lung cancer cohort with high genetic alteration of this gene signature exhibited shorter survival duration. In addition, the high expression level of the high genetic alteration of this signature mediated the high expression level of other oncogenic molecules. This showed that this signaling molecule does not only mediate progression, metastasis, and worse outcome, but also mediate the oncogenic activities of other signaling molecules. Here we evaluated the correlation between the expression level of the gene signature and tumor infiltration of both immune and immunosuppressive cells. And briefly, we found that the high expression level of this gene signature correlated negatively with the infiltration level of the active cytotoxic lymphocyte and T cells, while positive correlation exists between the expression level of this gene signature and immunosuppressive cells, including cancer-associated fibroblasts, myeloid derived suppressor cells, tumor-associated macrophages, and regulatory T cells. These immunosuppressive cells are known to mediate tumor immune invasion, their mechanism known as T cell exclusion. In line with our previous observation, we analyzed the level of the active cytotoxic lymphocyte within the tumor microenvironment of non-small cell lung cancer in relation to the expression level of the EGFR, the gene signature. And we found out that the expression level of this gene signature exhibits negative correlation with the level of active cytotoxic lymphocyte in the tumor microenvironment of non-small cell lung cancer. In addition, this gene signature mediated dysfunctional T cell phenotype, a situation whereby even the little active T cells that were present in tumor microenvironment are rendered inactive due to the oncogenic behavior of the signature. Okay, here we evaluated the binding efficacy using molecular docking analysis. Molecular docking analysis is the in silico simulation of the interaction between a target molecule and then and a small molecule, and it target proteins and a small molecule. So we use molecular docking analysis to evaluate the binding efficacy between NLOC15 and the signaling molecule compared to the osimertinib, which is a non-standardized EGFR TKI inhibitor. We found that NLOC15A exhibits higher targeting efficacy, higher binding efficacy to the T79M mutant-bearing EGFR. In addition, specifically, we found out that the NLOC15A binds specifically to the CY5797 region. This region has been implicated in the resistance to non-small cell lung cancer to osimertinib treatment. This result demonstrated that NLOCA had higher efficacy for targeting non-small cell lung cancer compared to osimertinib. In line with our observation, we conducted using a different variant, both T790M and C797 mutant-bearing EGFR. We found out that NLOC still exhibits higher binding efficacy towards this variant of EGFR when compared to the osimertinib. In line with this in silico analysis, our in vitro analysis revealed that NLOC15A exhibited dose-dependent anti-proliferative activities against non-small cell lung cancer with high CPT value of 1.9 and then 2.0 compared to the 5.56, 5.78 osimertinib. This result demonstrated that the NLOC15A exhibited more than times twofold higher activities against non-small cell lung cancer when compared to standardized drug, which is osimertinib. Here's the molecular docking analysis against other targets. This higher efficacy and NLOC demonstrated higher efficacy, binding efficacy with the active site of the mTOR and YAP1 TAD complex with higher binding efficacy of minus 9.1, minus 8.4, and minus 9.8. This result demonstrated that NLOCA not only targets EGFR but also exhibit higher target potential for mTOR, YAP-TAD1, MEK1, MAP2K1, which is MEK1, and thus named multi-target small molecule for the treatment of non-small cell lung cancer. In conclusion, our analysis of clinical non-small cell lung cancer cohort revealed that the dysregulation of EGFR, MAP2K1, mTOR, YAP1 signaling pathways was associated with the progression, immune-invasive phenotypes, T-cell exclusion mechanism, and worse prognosis of non-small cell lung cancer cohorts. Interestingly, we found that our small molecule NLOC15A exhibited anti-proliferative activities against two non-small cell lung cancer with higher efficacy compared to standardized drug osimertinib. In addition, this small molecule exhibited higher potential for targeting mTOR, EGFR, YAP1 MEK signaling network in non-small cell lung cancer. Thank you for listening.